So at ASH 2024 this year, the investigator on the CARTITUDE-4 clinical trial will be presenting data on MRD results. And so this is a randomized controlled clinical trial for which cilta-cel, or Carvykti, the BCMA targeting CAR-T, was approved in earlier line of therapy for patients with multiple myeloma. So we already saw in this randomized control study that a single dose treatment of cilta-cel yielded better PFS, and very recent report as well, now a statistically significant improvement in OS as well compared to standard of care triplet regimens. Not surprisingly, what we know is across all therapy modality for myeloma, if patients are able to maintain, first of all, reach MRD negative response, which is a even deeper response than a complete remission, and particularly maintaining it for a year or longer, those patients generally can do even better. And indeed, that is what we saw on this study, that patients on the cilta-cel arm had a much higher MRD negative rate, in fact, up to 6 times compared to standard of care arm. And so for those patients on the cilta-cel arm who's reached and maintained that MRD negative rate, their 30-month PFS and OS rates are very, very high, high 90s, almost close to 100%. So this speaks to that the cilta-cel can have a very deep response that translate to sustained durability of remission. And for patients who are able to reach these deep response, they will have PFS that is going to eventually translate report out much longer than the median PFS.